Good afternoon, folks. Great to see everyone. I must tell you, Bob McClure, you are always front and center on my screen. I don't know how that works out, but it's always good to see. I can't see your smiling face this afternoon, but there we go. I knew there was a smile there. Folks, I'm going to provide an update today. We're going to walk through. We presented to the board on Tuesday evening. I wanted to give you a synopsis of that, let you know where we're at. Really our vision moving forward, both at the elementary and the secondary level. So bear with me as I walk you through. Really what we're going to talk about are four distinct areas. I'm going to give you a quick review of what CDC put out last Friday, just so we're all on the same page and we understand the ramifications of that. Second point will be what we always do. We're going to review state, regional, and local COVID data. The DOH just updated within the hour our state data, so we have that newest data for everyone to see. District and building level COVID data, and then lastly, just our future discussions. What tier 3 learning model looks like moving forward, some sample timelines, where we're at, just so everybody has a clear understanding of where we sit at this point. So let's get started with the CDC side of things. Really, I can't say that we were pleased or disappointed. The reality of what the CDC put out was what we're living at Big Spring. So their opening phrase to the report was that schools that have strictly implemented mitigation strategies have been able to safely open in person and remain open. If you recall, that was the onus for our staying open plan. It wasn't about just getting open. It's about how we stay open. And when they then went on to define those 5 layers of mitigation, there were 5 layers distinct that we've been doing consistently as a group since the beginning of September. Universal and correct wearing a mask, physical distancing, hand washing and respiratory etiquette, cleaning, maintaining facilities, and contact tracing. When we look at those 5, it's not something we've backed away from, and they started from day one. We have 10 contact tracers trained in the district. We added maintenance staff. We used BioProtect in maintaining facilities. We did a review of our HVAC. We brought an outside company in to look at fresh air exchange. Obviously, the social distancing, where we've been with that, with our AB model. And then, of course, masks they're really a non-negotiable. So that was the one component, those layered mitigation strategies. Second component that CDC discussed was the indicators of community transmission to reflect level of community risk. Well, what have been the 2 data sets that I've shared with you pretty much every other week since April? Incidence rate and positivity rate for the state, for our region, and for our county, and even from our zip codes. That's the data that we've been talking about since day one that really has driven, whether we're tier 1, tier 2, tier 3, that's that data. So we've been on that. And lastly, a phase mitigation and learning modes based on that data. Well, that's our tiers. And we've communicated that since the beginning. So most of what the CDC report came out that was supposed to be earth-shattering really was a review for us. There's some districts and one data set that I don't believe I've shared with this group to help keep us grounded. 50% of students throughout the Commonwealth have not set foot in a classroom this year. 50% of students have not set foot in a classroom. Okay, now that's not 50% of school districts, but 50% of students. So when you look at these really 3 key areas and then the 5 layered mitigation that almost are commonplace for us now. They've taken some sacrifice, but it's just part of our DNA. It's not that way at other places. So kudos to the group. Kudos for your support. Kudos for your patience. It's put us in a pretty good spot. As CDC moved on, for districts, they talked specifically about those that were in-person instruction, that they needed, of those 5 mitigation factors, there were 2 that were critical: masking and physical distancing. And that physical distancing is at least 6 feet, needs to be maximized at the greatest extent possible. It doesn't say that it's mandatory. And that gets into that debate over 3 to 6 feet. But how we support that social distancing, that physical distancing, is by cohorting or potting to minimize exposure, which we can absolutely do at the elementary level. And quite frankly, we cannot do at the secondary level and support our schedules, in personalized schedules for students. We can't do that. And then installation of physical barriers is encouraged where it's difficult to maintain those 6 feet physical distance. We have 1,100 plexiglass dividers ready to roll. So as we start to talk about tier 3, where it's needed, we're going to do it. At the secondary level, we have a lot more flexibility, specifically at the high school. At the middle school, we may need to look at some things. That old design of that building, the old high school, it's a little bit different. High school, we're good with our class sizes and where we need to be when the time comes for tier 3. And elementary, we've done the square footage and we're set with our plan that we were ready to go with in October. So more to come on that as we go through the updates. CDC also touched on testing. When we can then layer testing to these mitigation strategies, it really can detect new cases and prevent outbreaks. Now, testing has always been an uphill climb for us. It's a mountain that's been tough for us to get up. But really, 2 types of testing: diagnostic. So once somebody shows some symptoms, our nurses are strongly encouraging them to get tested at that point. Once staff members are showing symptoms, most are getting tested, okay? Or you're heading into quarantine, or both, quite frankly. The side that we haven't been able really to crack is screening. And Dr. Roberts, Dr. Leonard, myself have had meetings with Shippensburg University. We're going to move forward with some screening protocols. We do have our hands-on tests. They are not inexpensive, but we're going to look, we're going to talk with as we become a little bit more comfortable what it could look like, but we'll look at some periodic screenings. We'll work through your association to really do what's best for our folks, to do it locally. Right now, that testing is still going to focus mainly on diagnostics. So we're buying tests from the university that we'll have on site, that we could test on site based on symptoms, and then send off to be acted upon. But do know, not too far off in the distant future, we think we'll be screening testing. Now, it's not going to be for students. Okay, that's a different nut to crack. But we can absolutely, much like we have with the vaccination process, I can make sure that we take care of us as a family to make sure that we're able to deliver in a way that's safe and keeps you safe. So more to come on that. We're finalizing those discussions, but we feel like we're in a really good place there to take the next step with testing with Shippensburg. Vaccinations. I'm sure if you read the CDC report, they sort of tiptoed with vaccinations. Obviously, absolutely recommended. What an interesting discussion when we talk about vaccinations. And you've heard me on my pulpit about vaccinations. And I'm certainly not jumping off that pulpit. But the way we've communicated this as a country, I think, has been mystifying, quite frankly. But that's where we're at. As we look at the vaccination phasing here in Pennsylvania, we can feel blessed that we were able to offer through our 1A group 180 a few weeks back at the meeting house. That group is queued up for February 26 or 27 to reoccur. I've confirmed, I'm sure those of you that have read about the Moderna update, there's some uneasiness in regards to Moderna's second dose because, quite frankly, Pennsylvania took some missteps, not our provider, okay, not Quality Care, Big Spring Pharmacy, but there were some missteps. In my communication as of yesterday, we still look good for next weekend. So those 180, I know you've already you should have received your email for your time, which is identical to your last time. But as of Friday, on February 19th, feel confident that you're getting that second dose. That can change over the next week because the state's up to their elbows in this thing now with Moderna and the second dose. But we're at a good spot right now. We're looking at obviously how quickly we can get to phase 1B to get the rest of us throughout the family vaccinated. I'm still hopeful of an April rollout for that. Who knows? I don't have a crystal ball that's real distinct with that. But when that happens, obviously they're pushing more vaccines out. My plan and pretty strong assurances I've had from Meeting House is we're going to be able to even offer one more 1A first doses at a site at our high school. And I'm pretty confident that when we get to 1B, we're going to be using the high school as well. So more to come in that. We're coordinating with the owners. I stay in consistent communication with them, and we're going to do what we can again to provide you the opportunity to keep you safe. All right, as we move on from vaccinations, one thing in the CDC report that I felt they did a really nice job of, that's pretty powerful for those that haven't spent time on it. We have several matrices in our staying open plan that I think took our community a while to get their arms around, but most people understand them now. Thankfully, the CDC did some charts that I think help that as well. So remember those two data sets that we always hammer on: incident rate, okay, or community spread, and positivity rate. Well, what the CDC did was break that down. We're currently in substantial when we follow our Department of Health matrices for where we're at as a county. CDC broke that down and they call it high transmission. It's red, and that's over 100. That's the same criteria used in Pennsylvania for substantial. Then they did the percent positivity, and they use that as over 10. Remember, that's something that I threw out with you in many of my updates when I was in communications with urban colleagues, even in Miami when they were struggling with this early on. Their threshold for that positivity rate was 10% of as a trigger. And we're in a really good place with that now, which we'll share that data as we work through the presentation. But you can see over 10 is the high transmission rate, and then positivity rate from CDC in that regard. When we overlay that with the learning modes, so CDC went and really broke it down, which, folks, I hope you can see at the end of the day that our state, they take a lot of heat. But when they did get information out collaboratively with DOH, Department of Health, and PDE, they did a really good job. And proactively is really what CDC is saying right now. So as you look at this chart, it talks about the various modes of instruction. The one thing that maybe would make you uneasy is the fact that we're concluding a winter sports season. It's quite clear that the CDC would say we shouldn't have done that. We followed PIAA regulations, and that is a whole different discussion that I don't want to get started on. But the athletic side's a bit uneasy when it comes to indoor. But where we've been at as a system, between that substantial and high transmission rate and how we've done AB, cohorting, reduced size, all exactly where we should have been. And the timeframes we followed are spot on. And what we're considering moving towards are spot on with some additional mitigation factors involved. So I feel really confident about what we've done to date. It's been a group effort, and we're going to continue to plug along with that. So let's look at our COVID data. I always love to put you to sleep with some data. We'll zip through this again. The state data moving in a great direction with an incident rate of 116, still too high, but remember where we were in the high twos and low threes just 6 weeks ago, and a positivity rate of 6.5. So as a state, moving in a really healthy direction in that regard. As a county, as we go to our next slide, you can see Cumberland County. And when I share the regional data with counties around us, our incident rate now is starting to get close to moving out of substantial. We've been getting information from our DOH of how we go to face-to-face within increased numbers in face-to-face within substantial. We're going to get to the point where we're going to be moderate, hopefully, maybe by as early as next week, we hope. And then a positivity rate of 5.4%. So again, data tracking in a way that really gets us excited. Now, let me talk to you real quick. Adams County right now, incident rate, because this is our region. We have a 5-county region that our folks work at, kids travel between, and we need to be cognizant of our region. because it really affects our community. So Adams County is an incident rate of 134 with a positivity rate of 9%. Franklin County is an incident rate of 115 with a positivity rate of 6.9. Dolphin, incident rate of 131 with a positivity rate of 8.2. And York is an incident rate of 147 with a positivity rate of 9.3. So as a region, all consistently under that positivity rate of 10%. Cumberland County has the lowest incident rate that is just on the edge of going to moderate. So much to be happy with there. We need to keep moving in that way as a community, make sure we keep spreading that word. It's moving in a good direction. As we look specifically at a zip code, this is really healthy compared to where we were. Now remember, this is easily influenced by smaller case numbers, okay, just based on the density of our zip codes. So it's easily influenced as we have a bubble, more so than state and regional data. But 12.7 for Newville's as low as it's been in quite some time. Carlisle continues to track high, and we see that with some of the challenges in the Carlisle area. Newburgh, very similar to the Newville, and then Shippensburg again, over that 20% in positivity rate. And you see the incident rate moving in a good direction. What's it look like for us as a district? Okay, we have a total count of 448, suspected cases of 80 since the beginning of the year, exposed 300, and 68 confirmed cases with staff and or students. Okay, 68 cases is 68 too many, but quite frankly, at this point, almost a year in, those numbers make me quite proud. We're doing what we need to do. And not in any of those cases via our contact tracing, could we determine that there was any spread within our buildings? None. And that's critical. So that's where we're at from a district perspective. Building specific, where we sit right now, you can see the quarantines. We have 2 confirmed cases, both at the high school, 1 staff member, 1 cyber student. And then the quarantines are anywhere from 3 to 10, depending on the building. Again, our quarantine numbers are going down to a point that we're not getting a ton of absences based on quarantines. So when you bring the 2 data sets together under the CDC framework, and you look at incident rate combined with positivity rate, you can see from a positivity rate, Cumberland County's in the moderate transmission. From an incident rate, we're in the high transmission. So what does that mean for us? Quite frankly, we need to go back to our reviews that we've done since day one. We use this data, we look at where we're at, and then we look at relevant research. There's a reason it's called a novel virus. It's new. So we learn something new pretty much every day. And there's new research coming out on a weekly basis. Much of that research lends us to believe that we can start to mobilize more at the elementary level. We had plans in place. Because our rates went up, we needed to step back from those plans. It's time we re-energize that. So a tentative date for implementation of tier 3 at the elementary would be mid to late March. Okay, and it's all going to be dependent upon trends with our positivity rate and incident rate. That's not going to change. But we're confident we can take the next step if our rates remain even at where they're at now, or pop up a bit, but in a controlled way, depending on what the variant does. Okay, and we know that variant's real and how we deal with that. What will that tier 3 look like at the elementary level? It's going to be Monday through Thursday, face-to-face, with individual specific student supports on Fridays. So Fridays are going to be time that we reset a bit, that you collaborate as a faculty and grade level, and then also you check in on specific cases. And over time, we may bring some more kiddos in on Fridays, specific, to lend support, to make sure that guys, I lose sleep over grades K through 2 from a literacy perspective. As we look at our benchmark data, it doesn't keep me up at night. As I look at our failure rate at the high school and middle school levels, it makes me uneasy, but it doesn't cause me to lose sleep. But with emerging readers, we can't wait one more second. Okay, so what we're working on, we're not only working on this plan to get us back in face-to-face, but we're looking proactively at a 3-year plan of how we address literacy at that emerging reader level. We're not going to get that time back. We're just not. And we know what research tells us. If you're not at grade level by 3rd grade, what can happen as a reader? And then what happens on the back end with the Wendy Hankus, the Bob McClures of the world that are working on word problems at the high school, and we don't have grade level readers, our jobs just become all that more challenging. So that K-2 scenario is critical for us from a literacy basis. So as we look at these tier 3 considerations, if the data were to trend back up and we can't at the elementary get K-5 back 4 days a week, we're going to look at ways to get K-2 in. Understand there's still going to be a plan for that if we need to do it. So you have the structure. Obviously, there's classrooms at the elementary. We're 6 feet. When we get the numbers back, we're going to have some classes of 21 or 22. Okay, that's the reality. We'll know more when we send out our survey. So we're going to have to add barriers. Okay, but it can be safely done. We clearly have between 3 and 6, but there's going to be classes that do not have 6. Okay, and we've planned for that. As we move through that from a secondary level, we're going to be staying where we're at. But the reality is we know it's critical to set the tone. What I would say in our last quarter of the year at the secondary level for how we're going to need to open next fall. Let's face it, folks, there's not a vaccine coming down the road for students. All right. The mitigation factors that we have in place now, I'll be shocked if that's not what we come back to. I don't see that being the case in September or late August. So the way we end the year with that last quarter is going to set the tone for how we start next year. So understand, I'm very comfortable with where we're at the secondary level with 4 distinct days of instruction. But once we get elementary back, we're going to fuel that conversation at the secondary level too of what 4 days would look like, knowing that we can't cohort kids. So how do we do that? What does it look like with layered mitigation in that regard? Those discussions will be happening. I'm not giving you a date, okay? Just know they're happening internally now. We're going to look at it. There's things that happen at the end of our years at the secondary level that, quite frankly, as a superintendent, I have to find a way. I'm not going to live through another group of kids missing out on things that we know are just vital to that 13th year and part of what we're about. So we're going to find a way, but we're going to do it in a way that's healthy and maintains a safe environment for all. But just know we're going to work through that. So what's it look like from a timeline perspective? We updated the board very 30,000 foot wise on Tuesday night. Our board is with us every step of the way. They have not squeezed me. I'm not getting pressure from board members to bring kids back earlier than what we're anticipating doing to a 4-day structure. We're very spoiled to be at Big Spring. I'm very spoiled to be at Big Spring. So they were updated on Tuesday. You guys are getting your update now. I'm doing a community video that'll be posted this evening. We're going to put out a family survey starting February 24th. It'll run through March 3rd, just to elementary families. Do you want to change your mode based on the chance of coming back face-to-face 4 days a week? We're re-energizing our departmental coordination meetings. We've talked about those before. That's what got us to the point where we were ready to go when we got to November and then needed to back off. But you see the 3 dates for that. We're communicating. When I do the community video today, I'm going to say mid to late March for a launch date at the elementary. I'm comfortable telling staff internally that our target date would be March 15th. Whether we are able to do that based on our ability to collect information, make sure our bus routes stay within the criteria for ridership that we've set, how we wiggle through that all is a work in progress. But in an ideal world, March 15th, the community's not going to hear that date from us until March 2nd. That's when we will finalize a date. And when we finalize a date at the elementary level, we'll then give a heads up to About a month in, we're going to begin this similar process at the secondary level. So it's a fluid process. It's one that remains in flux, but we're all in. Just know we're not going to back away from our health and safety plan in doing that. I think all of us as educators know we want our kids in the classroom. We have 4 distinct days at the secondary level, but we know those live stream days are a real challenge from an engagement perspective, and it's uneasy. We want those kids back as quick as we can get them back, but we're going to do it in a safe way and one that's very planned and supervised. So questions from the chat board at this point? With screening or diagnostic tests coming from the district, will that have an effect on the length of time we'd have to be out if negatives come back? It does. Kevin, I'll let you talk about those timeframes as our pandemic coordinator, but a negative test allows you to get back. There's still quarantining that needs to take place. And right now, with the information we're getting, even with those vaccinated, they're still quarantining. We're hoping to get more information from that. I can tell you New York still has a travel ban or travel quarantine on the backside for those that are vaccinated. So everybody's in a little different place, but Kevin, I'll let you speak to that.
Sure. So without boring you with all the details, the standard quarantine for an exposure is essentially 2 weeks, so 14 days. But there are ways with our screening, screening and testing, which is why we're actively pursuing it. There are ways to get individuals back more quickly, even as quickly as on day 8 after exposure. And there's rumblings from CDC with the vaccination as to not requiring a quarantine for those exposed to the virus after their vaccination has reached a full level of efficacy. So if it's the Moderna vaccination and it's 2 weeks after that second dose, from that point forward, if someone comes in close contact, so within 6 feet for 15 or more minutes with a positive case, there are rumblings, it's not guidance yet, but I can see the writing on the wall that will be coming, that those individuals will not need to quarantine. But again, back to the specific question, the reason why we're partnering with Shippensburg is so that we can help our staff get back more quickly through diagnostic testing. And very importantly, we've seen the impact of this virus and the economics of testing and the cost of testing, preventing students from economically disadvantaged families from getting back in a timely manner. So to help them get around that barrier, that's why we're working with Shippensburg as well. If we know a family cannot afford the testing, being able to step in and support those families so that those students can get back to school more quickly.
Those of you that have worked through or are working through a confirmed case, albeit yourself or a family member, just make sure you're checking in with your family doc in regards to the vaccination. There's pretty clear guidelines out there, but make sure you stay in touch. As that 1B group grows and we offer clinics here, when you have the opportunity within the time frame that you can and maybe should, make sure you know that information so you can plan appropriately. I love mom questions. What about kindergarten? Kindergarten will be 4 days of full day K. Okay, so our elementaries will be a K5 model of 4 days, everybody coming a full day, and Fridays as we described it to be. So kindergarten will get out of a half day model, they'll go 4 days a week. Actually, with our communication in regards to what vaccination, our provider right now is moving on from Moderna just because they can, but it's not Johnson & Johnson. That is not available yet. So it's a Pfizer at this point. Those that got vaccinated 3 weeks ago will get the Moderna again, obviously. But the next round, we anticipate being Pfizer based on that. We're going to talk more with kindergarten separately, okay? But what I'm telling you now is kindergarten will be a full day, what we've done for full day in the past, pre-COVID. But if we need to meet with our kindergarten group to go through that, we will. Everybody at the elementary, K through 5, 4 days a week, if they want to be face-to-face. How about other questions or concerns?
Dr. Fry, this might be a dumb question.
No question's a dumb question, Nick, you know that.
Tier 3, whatever that looks like for whatever level, what are the options that are going to be available to families? Just live stream and face-to-face, or will there be No, I guess that, never mind. Yeah, that already,
It's no, but it's still a valid, it's actually in our community update today, Mike. The same three choices that existed for families as we entered this are going to exist in tier 3. So they can come back face to face, they could go on live stream, or they can do on Big Spring Cyber.
okay.
We anticipate, listen, some of our live streamers, quite frankly, are live stream about the masking policy. So I would anticipate we're not backing off our mitigation strategies. So I would anticipate some staying in live stream and or our Kaola option, our Big Spring Cyber option. But we're not going to, elementary will be a great trial run for us on that. We'll see how the families respond back to the survey and where we'll get back. At the high school level, we're at a really good place with our class sizes. And Mr. August has worked through already ones that make us uncomfortable, that we would be moving into the LGI auditorium, different places. Middle school, I can tell you, we're going to be using the LGI. There's no doubt about it. And more than likely the auditorium, just based on numbers that we anticipate there and how we do it. The other reason, the wait until April is a lot of that is so we can get outside. We're going to get, you guys are going to have free reign to go wherever you need to go and do what we need to do. I struggle having these conversations around a damn assessment window that we're not able to back off of yet. But just know you're going to have the flexibility to do what you need to do. As of today, PSSA's grades 3 through 8 are on the traditional timeline, as are Keystones at the high school in grade 8, where we give them. We're hopeful that the feds will open up a window. But on today, Friday, February 18th, I'm not holding my breath. If they open a window, I believe what will happen for Pennsylvania, we will absolutely apply for a waiver, and then we'll be able to use our benchmark data, specifically at the elementary and middle school. I don't know what we'll do at the high school level. We do not have CDT data to speak of. So I don't know what we would be able to do with those three. And I will apologize profusely to our community in that regard, that they have to take those assessments. But I'm telling you, we're going to do what we need to do to comply, but we are not going to lose a wink of sleep when we've got kids coming back face to face, that we need to reorient them back to a building and make sure they're at a decent place from an SEL perspective and have them love school again. This is a superintendent that's not going to lose a wink of sleep over PSSA scores or Keystone scores. I don't know about my successor. He may wiggle around in his chair a little bit, but there's no rules during COVID. Everything's new. So shame on them for testing us. Other questions or thoughts?
Can I throw one thing out, Dr. Fry?
Yep.
So just one reminder, as we start to see the numbers move in a more positive direction, individuals start to receive the vaccination. Please, this is just a plea from your humble pandemic coordinator. Please do not let your guard down. Our nurses will tell you that we recently, about a week and a half ago, had one birthday party take out about 6 or 7 students. That certainly impacts kids, but the impact of COVID is much greater on adults. So do not move in a direction that could be considered reckless, is my plea. And that as hard as we've worked to get to this point, which if any of us, and Dr. Fry and I've talked about this often, if any of us thought in August that we would get to February 19th and have a relatively consistent experience for our students, we'd be extremely pleased with that, which we are. But as hard as we've worked, that can slip away in an instant and we could go back to tier 1. So please keep your guard up, keep doing everything that you're doing, and make sure that whether it's in the school day or outside the school day, that we're making great decisions not to contribute to the spread of COVID.
We had a question in regards to 1B and the timeline in regards to impact moving to tier 3. So the research that we're looking at, those that have been vaccinated are 180 plus within the 1A. I mean, that has a true effect even on the strain of the virus and how it's transmitted. If you dig in more and talk one-on-one with physicians that have dug in, there's a lot of positives out there about the vaccine. But moving to 1B absolutely will not affect whether we do or don't do tier 3. It really can't for us at this point. But what I would say to you with a wink and nod, you know, most of us on this meeting venue, if we look closely, certainly can make 1A work. That's a personal decision. But the way things are written for qualifications for 1A, and God knows this is not a guy 57 wanting to get a BMI discussion with anybody on this meeting, but those BMI numbers for adults are pretty crazy, and most of us would qualify. Just FYI, I'm not telling you that is not gaming the system. You need to do what you're comfortable with, but most of us would qualify under the 1A. When you've seen data that's come out in that regard, it's like 68 to 72% of professionals qualify. Just FYI. What other questions? More to come on specials at the elementary level. That's part of our work to be done as we queue back up. The live stream question is a great question for next year. We're going to be working with the association and a collaborative group of teachers of what it may or could look like. I think it's fair to say we know that live stream in some way, shape, or form is here to stay, and we'll need to get our arms around what that looks like. Obviously, it won't be at the numbers that we're dealing with now, but how we work with that, how we define it, will absolutely need to be an MOU that we work on. Remember, the MOU agreed on between the district and the association was a 1-year MOU. So it will be revisited. We'll look at it. We'll see where we're at. But we know that's a challenge. Honestly, as we look at public education moving forward, it's a part of where we have to go. If we don't, we're going to lose them. And if we lose them, it's not going to be a good situation in Pennsylvania from a public ed perception. Not with where cybers sit today. So we need to be realistic in that regard. Screening tests, we're starting off now with the diagnostic side. When we get to screening, I don't want to go too deep on what we may look at, but what we would probably look at would be on a weekly basis. And we haven't decided whether they would be random or everyone. That'll be how we're able to manage it, where we're at from a training perspective. So more to come on that. Someone develops symptoms from the vaccination, what happens? Use your sick days, okay? Because there are no more COVID days. You know, from what everybody's different in that regard. If it's something that is extended, you need to communicate with Kevin or myself, and we have some flexibility in that regard. We do, and we will work with you. Okay, we will absolutely work with you, but it's not a blanket if it's a day or two. But if you have something extended, we will work with you. How about other questions or concerns? Hey, I appreciate your time on a Friday afternoon. Kevin just popped in. It's that time of year where I'm more of a weatherman now than anything else again. But it looks like warm temps. Warm temps are coming. So hopefully everybody behaved when they were shoveling. Maybe get outside, enjoy the snow for one more weekend. Be safe. Hang in there. We're plugging. We're just going to keep chipping along, doing what we need to do. I love you all. Have a good weekend.